Hey everyone, this is on the CMS.gov Centers for Medicare and Medicaid Services, and this is in regards to special needs plans, and specifically this is the dual eligible special needs plans known as D-SNPs. There's also other ones like chronic conditions, special needs plan C-SNPs, and some other different ones, but this is specific to D-SNPs because it encompasses the folks that are qualified for not only Medicare but Medicaid. And so let's explain what a dual eligible special needs plan is. D-SNPs, dual eligible special needs plans. D-SNPs enroll individuals who are entitled to both Medicare, title whatever that is, to medical and medical assistance from a state plan under Medicaid, and states cover some Medicare costs, and depending on the state and the individual's eligibility. And so if you're Medicaid eligible, Medicaid eligibility categories, there's a few of them here. So Medicaid eligibility categories encompass all categories of Medicaid eligibility, including full Medicaid. So if you have full Medicaid, you'll know that. It'll say that when you went through qualifying through Medicaid. There's also qualified Medicare beneficiary without other Medicaid, QMB only, and then there's also QMB plus. There's specified low-income Medicare beneficiary without other Medicaid, that's SLMB only. And then there's also SLMB plus. Qualified individual is QI, and there's also qualified disabled and working individual, which is QDWI. And so you need to know your Medicare category to properly shop the marketplace for your Medicare Advantage plan that is specific to dual eligible special needs plans in the marketplace. And you can look at the marketplace on Medicare.gov plan tool finder for the upcoming year. I'll show you how to do that in just a second. And let's read through some of the last parts here. States may vary in determining their eligibility categories. Therefore, there may be state-specific differences in the eligibility levels in comparisons to those listed here. For some specific information regarding Medicaid eligibility, refer to the Medicaid website. And note, CMS no longer categorizes D-SNPs by subtype. And that was December 7th, 2015 by HPMS. So discontinued dual eligible special needs plans subtype categories. So D-SNPs with and without Medicare's $0 cost sharing. So this is really important. So there's two of them here. At the time of plan creation, each D-SNP, that's insurance company, must identify whether or not it offers Medicare's $0 cost sharing. That's really good because that means that's no cost sharing to the actual patient, the actual insured person. So in HPMS or in D-SNPs, those two plan types will have the option of one of the following two indicators: Medicare $0 cost sharing plan and Medicare $0 cost non-$0 cost sharing plan. All right, it seems like a double negative, but whatever. These two indicators will be used to multiply areas within multiple areas within HPMS and are essential to proper display of benefits in Medicare Plan Finder. And we're going to do that in just a second here. So let's go to the Plan Finder. And so you'll just go to on Medicare.gov. You can go to either find health and drug plans, or there's a big button on the front page. So I've already done a few of these, so I'll continue without logging in since I'm not. And then you'll click Medicare Advantage. Medicare Advantage. You'll type in your zip code, And this is for you and someone you know, like, and trust to help you shop for 2022 or the upcoming year dual D-SNP plans for yourself that are in the marketplace. And so just say, for this particular instance, I put full Medicaid, so this would be full Medicaid. This will be SSI. This would be SNPs, Medicare Savings Programs. This will be for extra help from Social Security. That's extra help on Part D drug costs. And you click next. And I put in some high-tier medications, and typically these wouldn't be covered fully on Part D of Medicare, but since this is Medicare and Medicaid, that means these high-tier medications for someone that say is, typically chronic conditions have very high drug costs. And you just pick a pharmacy. Try to obviously, if you're in a rural area, you're gonna have to go further out, but just always pick mail order, because the drug the Part D drug plans, or the Part D side of these Medicare Advantage plans, typically are trying to lower the cost through a mail order pharmacy. Okay, so I don't like to pick Walgreens because a lot of times they're out of network. I like to pick something that has big benefit towards the large distribution towards the beneficiary. And I also like, which is, I also like, Publix. And I think I put a CVS in there. Yeah, always pick CVS. Always pick something that's close to you in your area that has a lot of distribution. Okay, like store retail outlets. Okay, so this is what we have. So again, going back to the CMS.gov dual eligible special needs plans, D-SNPs. Remember, there's two cost sharing options. There's the Medicare $0 cost sharing plans, or there's the Medicare non-$0 cost sharing plans. And let's take a look. There's 47 plans that are D-SNPs. Look, it does say special needs, and this one's brand new, first choice, and this is just an example only, so you'll have to do it for your own specific area, your own specific drug list, and look at it. So as you can see, it's 0 health deductible, 0 drug deductible, and 0 retail costs. So if I look at the plan details, look, it does cover vision, it does cover hearing, it doesn't cover transportation, fitness benefits. It does cover telehealth. It's great. Look, $0 copay, $0 primary, and you just look at the plan details. And so this would be an example of, look, a $0 cost sharing D-SNP plan. And as you can see, you can call them directly to ask specific features of the actual Medicare-Medicaid D-SNP plan. And this is fairly new, so it doesn't look like it has a whole lot of data, and it doesn't have a whole lot of cost sharing because it's 0, which is clearly stated on Medicare on CMS.gov. Alright, and so we go back to here and you can see the next one. Obviously this has been in the marketplace, but it looks like there is some yearly drug costs in there, and there is, look, other out-of-pocket max you have to pay for in service. So if you're in chronic condition or have disabilities in Medicare Medicaid, you typically don't want any in-network or out-of-network max out-of-pocket. So if you happen to like, transportation benefit and dental benefit, but you're not worried about the $5,900 in-network, that's something that I would be worried about if I were in your situation, because of typically D-SNP plans are for folks that have chronic or disabling conditions. And so you can see here's more. We're in and out of network, 10,000, 6,500. Oh man, it just gets higher and higher, as you can see. Look at this one. Here's first choice again with the HMO. And remember, these HMO plans, those are more restrictive in nature, so they're more like make sure your doctors and hospitals and everything are within the network. You must be vigilant about making sure you're within the network, and the bills will be paid according to who's in the network. That's just something that you, the beneficiary, have to be vigilant about. Nobody else is going to account for that when you go into a new provider or anything like that. You have to make sure ahead of time. Okay, and looks like, yeah, it looks like there's just only one that has max out-of-pockets, and you want to ask, like, what would that max out-of-pocket be? Typically that would be for, like cancer treatments or cancer drugs on these Medicare Advantage plans. And so you have to read the fine print on your summary of benefits for these Medicare Advantage plans, for these D-SNP plans. But look at this, not applicable. So I like that one, but you might not get as many benefits as they're touting on the news. And so be very careful. If you've been with a company for a little bit, they do change each and every year. The networks change, the doctors change, the formulary or drug list that's allowed, it changes. And so you're in a situation where you may have everything covered, but they can change it on you each and every year, unfortunately, with these Medicare Advantage plans. And D-SNP plans are no different. So I hope this video has helped you and look into your my Medicare.gov account or Medicare.gov plan tool finder. It is just a general overview, because obviously there's local administrators and health organization, hospital organization, physicians organizations that have specific plans that they like to work with. You just need to find out from someone who can research it for you and knows what they're doing, and not there to just make a commission off you, to make sure that you get the plan with the providers that you want, with the benefits that you want, and know the expectations moving forward, whether there is some cost sharing ahead and some limitations on the actual plan that you're looking at. So take care, God bless. I hope this video has helped you on your Medicare journey.